Hello, I'm Dr. Cherie, obstetrician and gynecologist here at Mount St. John's Medical Center. January is Cervical Cancer Awareness Month, and we would like to take this opportunity to encourage all the women of Antigua and Barbuda to do their pap smears. Cervical cancer is cancer occurring at the neck of the womb, which is the lower part of the uterus. It is one of the leading causes of deaths amongst women in the Caribbean from cancer. The WHO estimates that in 2018, more than 500,000 women were diagnosed with cervical cancer, and almost 250,000 women died. More than 250,000 women died from this disease. Cervical cancer is very preventable, and so we'd like to just talk a little bit about doing your pap smears and when it should be done. Now, what is a pap smear? A pap smear is a gentle brush of the cervix done at a speculum examination to get some cells that we can look at under the microscope and see if there are any abnormalities. When we get those cells, we either place it on a slide or we put it in a liquid-based container. Once we've done your pap smears, we look for the abnormalities, and if there are any abnormalities, we then decide whether or not we need to do a colposcopy examination to get more information for either treatment or monitoring. Most of the cases of cervical cancer are actually caused by the human papillomavirus. Almost everybody is exposed to in their lifetime. The virus causes changes in the cervix over years, which can lead to cervical cancer. If these changes are caught early, we can treat it and prevent it from leading to cervical cancer. All women should start doing their pap smears at age 21, regardless of whether or not they're sexually active, and regardless of the type of sex that they may engage in. Women are able to stop doing their pap smears after the age of 65 if the last 3 pap smears at least have been normal.